What does a brain MRI reveal after a stroke? When a stroke occurs, timely diagnosis is crucial. One of the most effective tools for this is a brain magnetic resonance imaging scan. A brain MRI provides detailed insights into the location, extent, and age of brain tissue damage caused by the stroke. It can help differentiate between brain tissue that has been irreversibly damaged and tissue that is still at risk but may be salvageable. One of the key MRI techniques is diffusion-weighted imaging. This method can detect early ischemic changes within minutes of a stroke's onset. It shows areas where water movement is restricted, indicating the core of the infarct, which is the area of dead tissue. Another important sequence is fluid-attenuated inversion recovery. This technique helps estimate the age of the stroke lesion by revealing changes related to swelling and tissue injury that develop over hours to days. Combining these two imaging techniques allows healthcare providers to determine if a stroke is recent enough to benefit from treatments like thrombolysis, which is a procedure to dissolve blood clots. Additionally, MRI can reveal vascular abnormalities, such as blocked blood vessels or poor collateral blood flow, using magnetic resonance angiography and susceptibility-weighted imaging. As time progresses, changes in the brain's tissue can be observed on T1 and T2 weighted images. These changes reflected the progression of tissue injury over hours to days. Advanced MRI techniques, such as functional MRI, can even assess changes in brain connectivity and recovery processes after a stroke, although these are often used in research settings. In clinical practice, brain MRI plays a vital role in confirming a stroke diagnosis, especially when the timing of the stroke onset is unclear. It guides acute treatment decisions, such as whether to proceed with thrombolysis or thrombectomy, and helps plan rehabilitation strategies based on the extent and location of the brain injury. Moreover, MRI can help rule out other causes of neurological symptoms, such as bleeding or tumors. Overall, brain MRI is highly sensitive and specific for diagnosing acute ischemic strokes. It is more effective than computed tomography in the early hours after a stroke, although it may be less available and take more time to perform. This information aligns with current medical consensus from major health authorities and stroke guidelines, emphasizing the importance of MRI in acute stroke diagnosis and management. Always consult healthcare professionals for personalized medical advice and evaluation.